Give me a moment. Huh. Okay, thank you. I feel much better. My name is Dr. Ali Reza Panahpour. I was born in Tehran, Iran. I've always had an amazing curiosity for creation, for art, been a very curious individual throughout my life. But if I had to really sum it up, I would say I'm a happy warrior. I try to fight for the good cause, speak for the people who can't speak for themselves, and fight for the ones who can't fight for themselves. My passion in dentistry started very early. My father was a dentist. He is a dentist. My brother is a dentist. So it's in my blood. My father used to take me to his office as a child, and all I loved to do was watch him work. I even assisted him as a child with his big surgeries and work in the dental laboratory. That was my passion. That's what I wanted to do all day. When other kids were outside playing volleyball or basketball or what have you, I wanted to be in a dental laboratory. I wanted to watch my father. I was just amazed by his presence, his authority, his knowledge, and his talents mostly. A lot of the methods that I still use right now are what I saw him use watching him as a child. When I got into dental school, really early, the first year of dental school, I was handed down 300 patients that I had to resume care and treatment. And I had to review all these 300 charts, and that's where I saw it. I hadn't even graduated yet. I was in just the middle of my training, and I saw it there. These 300 patients, literally the same pattern. Little filling became a bigger filling, became a bigger filling, became a root canal, was extracted, became a bridge, became a crown. That's where I saw that pattern. And again, that did not sit right with me. It's impossible. So there had to be more to dental care than I was being taught. Your teeth are true barometers of your health, honestly. Every teeth has a arterial, neural, lymphatic connection to the rest of the body. So if something is off, if something is diseased, if something's not right with this oral cavity, with the harmony of your cranium, and that will have a ripple effect on the rest of the body, and vice versa. And what we have seen within the past 2 years, and what they refer to as oral medicine. For example, early 1990s, if you were diabetic, you had gum disease. They went hand in hand. Now, 20 years later, we're not sure if the diabetes causing the gum disease or the gum disease causing the diabetes. So tooth decay, TMJ issues, clenching, grinding, they're all a systemic manifestation. More and more research now is being presented to us as showing us the link of dental infections to the rest of the body. So if you have an infection in your mouth, well, your liver, your kidney, your adrenals, your GI, your whole system is going to be reacting to that disease. So the whole concept of teeth are not a part of the body, that's passe. That does not stand no more. What makes my dental practice different, I would say, started really early in my career, where I saw this trend of repetition. We're all so different individuals. How could the same pattern pertain to all of us? So, and of course, being afraid of failure, I took it upon myself to take as many courses, residencies, subspecialties as I could throughout my career. An average dentist usually averages about 60 units of continuing education every 2 years. There was a time I was actually averaging about 200 units to 300 units a year, constantly traveling, constantly trying to get my hands on more information, more research, more ways to avoid any kind of dental failure. You know, I'm a professional student. I have spent ample time on every subspecialty, every residency program, anywhere from chirodontics to TMJ problems, to facial rejuvenation, to aesthetics, to full mouth reconstruction, you name it. Thank God for my travels. I have family all over the world, so summers, vacations, I was always abroad, and I have a lot of family that are also in the medical field. I remember in 1993, I was in Sweden and I was going through a training to become an implantologist, so I can start doing implants in my practice. And it was then that Sweden banned mercury. I was so excited, I was so just butterflies. I come back to the States, I had ample amount of research, not only from the university in Sweden, but the World Health Organization, that look at what the research has proven about mercury in silver fillings. But unfortunately, due to certain governmental agencies and their interest, I was frowned upon. I was even being attacked by speaking out the truth. Let's take a step back. Before I became a dentist, I had to take physiology, histology, biology, chemistry, genetics. I mean, I can go on. And one thing that all these classes had in common was the periodic table. So number one most toxic substance in the world on our periodic table is plutonium. And what do we do with plutonium? We make atomic bombs with. Number two most toxic substance element in the world is mercury. So how could any amount of mercury be safe? So I started asking questions really early in my dental career. Again, I was frowned upon. I was told that I just need to hush up and just continue the program. Well, that did not settle with me. And then to find out that the patent on these mercury silver fillings were owned by the American Dental Association. The association that I represent, they have a patent on silver amalgam mercury fillings. And check this out. A device that is used outside of the body. So the American Dental Association is saying that your teeth are not a part of your body. And that's ridiculous. So imagine lobbyists went to the Capitol and passed this law. Who finances that? Who supports that? Well, people that have financial interest or organizations that have financial interest in this matter. But is it the best thing for the people? Of course not. Most of the people that go to the dentist have no idea what's being placed in their mouth. There's actually gag laws placed in some of the big states that a dentist is not allowed to tell their patients there's mercury in their silver fillings. Any manifestation, any alteration on the oral cavity, on this cranium that's supported by your upper and lower teeth, will definitely have a manifestation on the rest of your body. Tooth decay, gum disease, dental infections, TMJ issues, cranial issues, these are all chronic inflammation. High blood pressure, diabetes, GI issues, cancer, these are all manifestations of chronic inflammation. And we know that chronic inflammation is responsible for more than 80% of the healing crises that we're dealing with as a public. I'll give you a perfect example that just happened recently. A patient of mine referred her mother. Her mother comes in, really, I have my own dentist, I don't know what I'm doing here. My daughter told me to come here, I'm not really happy. Okay, sorry, well, pleasure, come on in, have a seat. I called the daughter and I said, Diane, your mom is here. She's not really happy being here. What's going on? Well, my patient told me that her mom is scheduled to get a cataract surgery in a few weeks. But the daughter feels that there's something off, something's not right. Okay, so I looked at my chart, dental acupuncture meridian chart, and the part of the eye that she needed surgery was connected to the lower left area of her lower jaw. So I asked her, what's going on in the lower left area? She says, I have a root canal. I'm not taking it out. I've heard about you. Well, everybody knows I'm not a big fan of root canals. So I basically had to do something for the patient. So I mixed a few remedies together. I injected around the root canal just to kind of tell the body everything is okay. There's nothing going on. And I even didn't charge the patient. I asked the patient, go home, thank you. And jokingly, I said, I hope I never see you again. Well, God and behold, 20 minutes later, I'm working with a patient. My assistant approaches me and says that patient that was just here, she's on her way back. Why? I don't know, doctor. She says she's on her way back. She wants to talk to you right now. Okay, I get on the phone. How can I help you? I'm coming back. I want you to take this tooth out. Why? Because all my cataracts problems have gone away. Now, this doesn't happen with every patient. I would say in about 1 to every 3 to 4 patients, we do see a quick manifestation of dental issues and the rest of the body. Of course, I follow the right protocols. I send the patient to a root canal specialist that said that the root canal was the most perfect root canal he's ever seen. Well, then again, he did the root canal. And that she is crazy if she's going to have a tooth out. But she was convinced. She was convinced. So I followed the proper protocol. She came in, I removed the root canal, and I did find a cyst that was hidden, that no image picked it up. Patient went home, everything healed fine. In 30 days after surgery, I asked my patient to go back to the ophthalmologist and just get another exam. Remember, this ophthalmologist was scheduled to do this surgery. Last minute, she cancels it. So she went back to the ophthalmologist, not just one ophthalmologist. I paid myself for the second ophthalmologist. And both said no cataract surgery was needed. I happened to get a call that afternoon from that ophthalmologist, very upset on the phone, asking me, hey, what kind of witchcraft are you doing over there? And I simply said, well, which craft are you talking about? I know biological dentistry, I know systemic dentistry, I know applied kinesiology, I know neurotherapy. Which craft are you talking about? And he hung up on me, which simply should have been, how? Why? I want to know, teach me. But unfortunately, in our medical world today, everyone's so focused on what they're doing, and they just don't take the time to find out all the other related conditions that could apply to their specialty. Let's look at a simple case. Patient comes in, never had a cavity before, and now they have tooth decay. They brush, they floss 2 to 3 times a day, they take good care of themselves. Of course, as a dentist, I need to remove that decay most biomimetically as possible, or better yet, non-invasive as possible. And then I have to put a filling in that tooth to replace what I've removed. Again, I would have to be very conscious of the materials that I'm using. So I don't use any plastics. I don't use any mercury fillings. I use more biocompatible, biomimetic type materials. But my question would be, why did you get that decay? What is going on with your system that you're getting this tooth decay? If you're not brushing and flossing, well, let me teach you properly how to brush and floss. But further, I want to know why? Because if I can find the reason why, working with my patient, working with her other doctors, then I can put a stop to that. If not, that patient is going to be presented to my office every few months with a new cavity, with a new cavity, with a new cavity. I'll give you the second issue that I see over and over again. Patients come to me, I have to go to the dentist every 2 months to get my teeth cleaned, and I have to pay anywhere between $400 to $600. Why? Well, why? We know that buildup of this bacteria is hormonal, pH imbalance, etc., etc. So yes, of course, I would have to clean that mouth, remove all that bacteria. But then again, I want to know why. Because if I'm able to find out why, if I'm able to lead that patient, direct that patient to the appropriate channels, then fix the pH, take care of the hormones by working with other specialists, then I've truly helped my patient. So if I have a patient that keeps coming back to my office every few months with a new issue, then I've totally have let them down. And that's not why I got into healthcare business. My usual day, I see probably about 2 to 5 new patients. And I would say 90% of them had the same comment. I am getting tired and sick of going to the dentist every 6 months and having more problems, more tooth decay, more tooth fractures, more root canals. I'm just sick of it. I'm done with this. I'm not your average dentist. I'm not the drill it, fill it, bill it type dentist. As I said, if you come to me and you've had broken fillings every few months, or any other issue, I need to get to the bottom of it. Is it systemic? Is it mechanical? Or just incompetent dentist? You know, I would say, if you're asking me how many dentists in the States or in the world practice this type of dentistry, I really only have a few names that I can share with you. Other than that, it's really what you put into it. I love traveling. I love continuing education. I'm a very curious individual. If I hear of a dentist doing something phenomenal in, I don't know, Zimbabwe, you know, or somewhere other place in the world, I want to go there. I want to find out. I want to see what they're up to and how I can incorporate that technology, that advancement to my practice. One of the new frontiers in dentistry right now is dental epigenetics. Basically, epigenetics states that our DNA, our composition, is reactive to our environment. So what we thought as years ago as we just being a physical body, well, that's also passé. We are a physical, energetic, mental, intuitive, spiritual beings. And all of that affects your DNA, your health, and especially your dental epigenetics. A few months ago, I spoke in a very prestige symposium. And as I was giving this lecture, I'm looking at the 300 doctors that are sitting in front of me, and they're all looking at me like I'm some sort of an alien. So I kind of paused and I said, well, you guys, before I go any further, can I ask you guys a question? When was the last time you guys took a class in restorative dentistry? Not even one person raised their hand. When was the last time anyone took a class in adhesive dentistry, like sticking things together, bonding things together, which is the fundamental of every dental practice? Not even one person raised their hand. So what's clear to me is that at the end of the day, you could be a biological dentist, alternative dentist, green city dentist, whatever you want to call yourself. But it's about being a conscious dentist. So what was apparent to me that these dentists learn from their vendors. Basically, people that come in to sell them the product, that's who they're learning for. Where I had to spend 2 years traveling different parts of the world to become a dentist that was certified in and an instructor also of biomimetic dentistry. Whole different concept of doing fillings. I can't remember the last time I did a crown in my office. As I mentioned, in 1993 when I was in Sweden and the Sweden government banned mercury. Well, within a few months, these other European countries also banned mercury. Belgium, Switzerland, etc., etc. So I hope that we could learn from these European continents of why and their reasoning, and be able to bring that to our own country here. Why do other dentists don't practice this form of dentistry? I would say I would have to ask them. It's obvious to me, if I'm dealing with the second most toxic substance in the world, that I would never put it in anybody's body, or better yet, when I remove it, I'm going to make sure I take special precautions for me, my environment, the future of my children, my assistant, my staff, not to get poisoned by that mercury being removed and vapor in the air. So I would say you have to ask them. All I know is me, my life, and my awareness in the work that I do. What I see the future of dentistry is more mechanical type dentistry, where a dentist basically from home can tap into their system and mechanical arms will fix your cavity or crowns or what have you. I see tooth being able to be regrown in laboratories and even through stem cells within the jaw. So a lot of wonderful things are happening. We just have to be patient and keep an eye out. Plasma-rich protein. Well, it really started with our athletes a few years ago. They would get their blood withdrawn, have it centrifuged, grabbed all the good stem cells and proteins, all the good stuff, leukocytes, all rebuilding molecular stuff, and they would have it injected to different parts of the body, joints and what have you. And of course, they would have to go to Korea, Japan, Germany to get this done. So a few years ago, a few companies came, showed their research, got their FDA approval, and doctors, surgeons around the world started using these technology. Basically, in dentistry, we use it for multiple different, I would say, challenges. Anywhere from rebuilding bone to rebuilding the periodontium, using it to inject TMJ joints, other parts of the body, even vampire facelifts, facial rejuvenations. So it's beautiful, beautiful salt. I call it liquid gold. This is where our patients come in, we withdraw blood. Depending on what we need, we will centrifuge it at a certain frequency and time, and then use that plasma to make bone, facial rejuvenation, TMJ therapy, gum therapy, you name it. If you'd like to know more about me and my passion and my experience, you're more than welcome to read my book, The Good Dentist. It's available on Amazon and Kindle. We are working on having the book printed. I am working on a campaign to actually go out there, plant twice as much trees that it would take to have, let's say, 100 books printed and available for the public. The best way you can find me is, of course, YouTube, internet. My website is www.systemicdentist.com. And I do have two practices. One is in Bellevue, Washington. The other is in Santa Monica, California, that I go back and forth. I do lecture quite a bit across the country and out of the United States as well. So I wish you all the best, and I hope I never see you, but if you do have any dental issues, please give me a call. My name is Ali Reza Panahpour, and I approve this message.